We now turn focus to the surge of JN.1 variant of COVID. The spread of the variant, the virus that caused COVID in the first place, is becoming a cause of concern. Also, Health Minister Mansukh Mandavia conducted a review of health facilities nationwide, emphasizing on the importance of staying alert to emerging strains of the virus. The government has also issued a directive to states and union territories, urging them to stay vigilant as COVID cases rise, coupled with the emergence of the JN.1 variant. The centre has asked the states to conduct more and more RT-PCR tests. Besides, it also asked government to create awareness on masking up and ensuring social distancing, as there should be no laxity in our preparedness. The Indian Council of Medical Research is working on genome sequencing of the new JN.1 variant of COVID. The southern Indian state of Kerala reported 300 new active cases of COVID and 3 deaths on December 20th, as per the Ministry of Health and Family Welfare. The total number of active cases of COVID in the country stands around 2,669. And Sam Kadammanitta from Kerala is joining us to get us more. Sam, good morning. We've told our viewers about the caution which the government has taken with regard to the spread of JN.1 variant. And at the same time, 300 cases have been reported from Kerala. Get us the latest current situation from the state as of now.
Yes, hi Pradeep. The Health Minister Veena George attended the review meeting yesterday called by the Union Health Minister. In that meeting, the Health Minister informed that the situation in Kerala is under control. Kerala Health Minister Veena George said that there is no need to worry, even though the case of COVID are increasing in the state. State Health Department had taken measures to manage the present situation. Guidelines were also issued. The state medical officers conference was also instructed to take action. State Health Department and Health Education Department is ready to handle any alarming unforeseen situation. The JN.1 Omicron variant was confirmed in only one sample obtained from the state. The person was cured also.
All right, Sam. Also, we see the sudden rise of cases in Kerala. What are the reasons that the authorities are attributing to with regard to the surge in the cases?
Kerala Health Minister Veena George said because of the tremendous spike in fever cases, COVID testing rate also increased, hence positive cases being reported as well. Meanwhile, the opposition leader V.D. Satheeshan accused the government of trying to cover up the spike in COVID cases, citing reports by the Ministry of Health. He said 85% of the cases in the country had been reported from Kerala. The government is purposely hiding the real count and the situation only because of the Navakerala Sadhas have been conducting by the state cabinet. All the 21 ministers, including CM and Health Minister, traveling all over the 140 assembly constituencies, trying to showcase the achievements of the state government in their tenure. There are 140 public meetings arranged and a huge gathering of party activists is being seen. Opposition leader also mentioned that the strict restriction and imposition will be taken by the state only after the valedictory function of the Navakerala Sadhas happening on December 25th. The alarming rates will be shown to the public only after that. He also stated that the ruling party CPIM is trying to build up the public imagery before the Lok Sabha election and is gambling with the people's lives in their hands for their benefits. BJP State President K. Surendran asked the government to take immediate measures before people start panicking.
All right, Sam, any word of caution by the state authorities or any kind of a regulatory order given by the state authorities?
Yeah, presently there are no instructions imposed by the government to the public, but government gives strict instructions to the hospital authorities that all patients and all the outpatients and inpatients and all other hospital staff should wear the mask. But there is no restrictions or any other mask wearing restrictions for public.
All right, Sam, we leave it here. Thank you so much for joining in with those details. So that was our correspondent, Sam, joining us and getting us more on the current situation with regard to the surge in COVID cases in Kerala.